everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Rasagiline. Its brand name is Azilect. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Rasagiline is an irreversible inhibitor of monoamine oxidase. Although its exact mechanism of action is still not completely understood, it's thought that it mainly affects monoamine oxidase type B, which is very prevalent in brain tissue, and this causes an increase in dopamine activity in the brain. In terms of indications for use, Rasagiline is indicated to be used in the treatment of Parkinson's disease. Now, before somebody was to use Rasagiline, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used with other monoamine oxidase inhibitors, as well as meperidine, tramadol, methadone, due to an increased risk of serotonin syndrome. You should always allow 14 days after stopping Rasagiline before starting any of these compounds. Medication can also not be used with cyclobenzaprine or the over-the-counter medication known as St. John's wort. Now, in terms of precautions and warnings, patients should be made aware that new onset of hypertension may occur. Hypotension, which is low blood pressure, as well as orthostatic hypotension, which is a drop in blood pressure when going from a seated to a standing position, have both occurred. They're more likely to occur in the first 2 months of therapy. There's an increased risk of melanoma in patients with Parkinson's disease using Rasagiline, so monitoring will be recommended. You want to, when able, to avoid using this medication in patients who have moderate to severe hepatic impairment. Serotonin syndrome has been reported with the use of this medication, so certain antidepressants like some SSRIs should be avoided with this medication. Somnolence, as well as falling asleep during activities of daily living, may occur with the use of Rasagiline. New or worsening dyskinesias may occur when Rasagiline is given with levodopa. Behavioral changes, as well as hallucinations, have both been reported during initiation of therapy, as well as during increases in dose. If this is to occur, sometimes the dose may have to be decreased, or the medication may have to be stopped. Medication would not be recommended to be used in patients who have major psychotic disorders, as it may exacerbate psychosis. And finally, impaired impulse control and compulsive behaviors have been reported with the use of Rasagiline. These could include the urge to gamble, the urge to spend money, as well as sexual urges and binge eating. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Rasagiline, they can expect to receive their dose orally. So if somebody is using Rasagiline to treat their Parkinson's disease, and they're using it as monotherapy or adjunct, but without levodopa, they can use 1 milligram once daily, and that would be the maximum dose. If they're using the medication with levodopa, they would initially start off with a dose of 0.5 milligrams daily, and if needed, the dose can be increased to 1 milligram. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Rasagiline, so I'll go over some of those here now. Orthostatic hypotension can happen between 7 and all the way up to 44%. 7% of patients may experience peripheral edema. Rash comes in between 3 and 6%. Between 2 and 9% of patients may notice a decrease in their weight. Constipation can happen up to 9% of the time, and indigestion can happen up to 7% of the time. Nausea comes in between 6 and 12%, and vomiting falls between 4 and 7%. 5 to 11% may experience joint pain. 7% may experience dizziness. 14% may experience dyskinesias, and up to 14% may experience a headache. 5% of patients may experience depression. The more serious side effects would be hypertension that comes in at 4%, serotonin syndrome, as well as compulsive behaviors. That's all we're going to talk about today with Rasagiline. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.